Pralatrexate, also known as Folotyn Vial, is a medication used to treat peripheral T-cell lymphoma, PTCL, a certain type of cancer. It works by slowing down or stopping the growth of cancer cells. The recommended dose of Folotyn Vial is usually once a week for 6 weeks. The best time to take it is based on your doctor's advice, so be sure to follow their instructions carefully. It's important to take the medication exactly as prescribed to get the full benefit of the treatment. Before starting Folotyn Vial, it's important to read the patient information leaflet from your pharmacist. This medication is administered by a healthcare professional in a clinic or hospital, usually once a week for 6 weeks. If you experience redness, pain, or swelling during your injection, notify your doctor or nurse immediately. The dosage of Folotyn Vial is determined based on your body size, medical condition, and response to treatment. It's important to use this medication regularly to get the most benefit from it. To help you remember, mark the days on the calendar when you need to receive the medication. Your doctor may also direct you to take folic acid and receive vitamin B12 shots to help prevent mouth sores. Be sure to carefully follow your doctor's directions for all your medications. Sores or pain in the mouth and throat may occur. Be gentle when brushing your teeth and avoid mouthwash with alcohol. Rinse your mouth often with cool water and baking soda or salt. Eating soft, moist foods may also be helpful. Nausea is also a possible side effect. If any of these effects last or get worse, let your doctor or pharmacist know. It's important to remember that this medication has been prescribed because the benefit to you is greater than the risk of side effects. Serious skin reactions can happen, so tell your doctor right away if you develop rash, peeling, sores, or blisters on the skin. You should also contact your doctor right away if you experience any serious side effects, such as easy bleeding or bruising, dehydration, feeling weak, looking pale, or shortness of breath. This medication may lower your ability to fight infections, so be aware of any signs of infection and let your doctor know if you have any symptoms. Pralatrexate may cause side effects due to the rapid destruction of cancer cells, so your doctor may prescribe additional medication and advise you to drink plenty of fluids. Be sure to contact your doctor if you experience symptoms such as low back/side pain, signs of kidney problems, or muscle spasms/weakness. While a serious allergic reaction is rare, seek medical help immediately if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects not listed. Before taking Folotyn Vial, make sure to inform your doctor or pharmacist if you have any allergies or if you have a history of kidney disease or liver problems. Folotyn Vial may increase your risk of getting infections or worsen current infections. Avoid contact with anyone who has a contagious illness such as chickenpox, COVID-19, measles, or the flu. If you have been exposed to an infection, consult your doctor for more information. Prior to receiving any vaccinations, let your healthcare professional know that you are using Folotyn Vial. Also, avoid contact with individuals who have recently received live vaccines, such as the flu vaccine inhaled through the nose. To minimize the risk of injury, use caution with sharp objects and avoid activities that may lead to cuts or bruises. If you are planning to have surgery, be sure to inform your doctor or dentist about all the medications and products you are using. For women, it is important to discuss reliable forms of birth control with your doctor during treatment with Folotyn Vial and for 6 months after the last dose. For men, reliable forms of birth control should be discussed for 3 months after the last dose. If pregnancy occurs, speak to your doctor immediately about the risks and benefits of using this medication. It is not recommended to breastfeed while using Folotyn Vial and for 1 week after the last dose. Consult your doctor before breastfeeding. When taking Folotyn Vial, it's important to be aware of potential drug interactions that could impact how the medication works or increase the risk of serious side effects. It's essential to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this with your doctor and pharmacist. Never start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Folotyn Vial include NSAIDs, such as ibuprofen, naproxen, probenecid, and sulfa antibiotics, such as trimethoprim/sulfamethoxazole. It's also important to carefully check the labels of all prescription and non-prescription medicines, as many contain pain relievers and fever reducers, NSAIDs, which can increase the risk of side effects when used with Pralatrexate. Be sure to ask your pharmacist about the safe use of these products. As for the optimal timing and dosage of Folotyn Vial, it's crucial to follow your doctor's recommendations. They will be able to provide specific instructions based on your individual needs and medical history. Be sure to discuss any concerns or questions with your healthcare provider to ensure the safe and effective use of this medication. If someone has taken too much Folotyn Vial and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call the local Poison Control Center at 1-800-222-1222, while in Canada, residents can call a provincial poison control center. Before starting treatment with Folotyn Vial, it's important to undergo lab and/or medical tests, including complete blood counts, liver function, and kidney function. These tests should also be continued throughout the course of treatment. It's crucial to attend all medical and lab appointments to monitor the effects of the medication. Make sure to take each dose of Folotyn Vial as directed by your doctor. If you happen to miss a dose, be sure to consult your doctor or pharmacist for a new dosing schedule. This medication is administered in a hospital or clinic and is not meant to be kept at home. It is used to treat a certain type of T-cell lymphoma. The dosage and timing of the treatment will be determined by a healthcare professional based on the individual's condition and response to the medication. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.